Hey guys, today I'm going to talk about how to become a faster dental assistant. As most of you guys know, I am an orthodontic assistant. However, I have assisted in general dentistry before I became an orthodontic assistant. We will just get right into the details. All right, let's go. So I do want to put out two disclaimers before I get into tips. The first one is know that you do not have to be a fast dental assistant to be a good dental assistant. Some dental assistants, they are good, but they take their time and it does take them longer. That does not mean that they're a bad dental assistant. Second thing, the patient comes first. You don't want to be so caught up in trying to be a fast dental assistant that you forget about the patient. If you find yourself rushing, trying to be fast, you can find yourself being rough, and that's not good for the patient, because if you're rough, they're going to complain and they're more than likely not going to have a good experience and they're not going to want to come back. So just make sure you keep the patient in mind. Okay, so the first tip, you want to make sure you practice. If you can, go ahead and start working full time, even if you're new and you have no experience. You don't want to work your way up. You just want to go right in, hardcore, full time, 40 hours every day. That's how you're going to learn and how you're going to become quicker. Is just being exposed to what you're supposed to do every day for 8 hours. The next thing, you want to work on things you don't know how to do or things you haven't really grasped yet. You don't want to continue to work on things you already know or things that come easy to you. It's really easy to shy away and get caught up and to do the things that you're comfortable with and to avoid the hard things. But if you want to become faster, you want to just go ahead and tackle those things you don't know how to do. The more practice you get, the more you'll learn, the more you'll be comfortable, and then the faster your pace will be. So if you do have the opportunity to do patients that you don't have experience with while getting help and shadowing, go ahead and do that. The next thing, you want to study when you're home, outside of work, outside of your 8 hours, your 40 hours a week. You want to take time and study at home. Go ahead and study the instruments you need to know, the procedures, the steps. Having that extra time will help you, because seeing it and practicing along with extra studying at home will just bring it all in together, and then before you know it, things will just come naturally. The next thing, when you're slow and you have a downtime in the office, you want to take those opportunities to shadow your other coworkers and see how they do things. A lot of dental assistants, they have different techniques of how they work and how they get things done. So if you have that opportunity to shadow another dental assistant and see how they work and see how they do things, because you may find how one person does something is quicker compared to the way you were doing it. So whenever you have downtime and have the opportunity to, go ahead and shadow your coworkers. The next thing, you want to do things in an efficient order as a dental assistant. As a dental assistant, you do have procedures that are done in a certain way. However, if you're more so of an orthodontic assistant and you're working solely on your own 90% of the time, which we do, you have more leeway on what you're going to do first versus what you're going to do last. For example, when I go to take braces off, I have to do multiple things. I have to take photos, take impressions, pour up models, make retainers, along with taking the braces off and taking the glue off. So in order to be efficient, I'm not going to take my braces off and then take pictures and then take my x-ray. I will take the braces off and get the impression immediately and then pour up my models. Because as a dental assistant, you guys know when you pour up your models, you have to let that sit and the material has to harden before you can take the model out from the impression. So while that's sitting and hardening, you can go ahead and take your photos and take your x-ray. So you find yourself killing two birds in one stone. So instead of doing the photos and the x-rays after you take the braces off, You then have to take the impression and then sit there and wait for your model to harden after you pour it up, which you can do it that way, but you'll find yourself wasting time and you'll be there a long time compared to if you did it the other way around. So if you have the opportunity to pick and choose what order you do things, make sure you do it in an efficient order so you're not wasting time. Next thing, you want to keep a mental note of when you checked the patient in. You don't want your patient in the chair for longer than they need to be. So if your patient came in at 10:30 and you know their appointment's a 30-minute appointment, you want to make a mental note and make sure you're just not wasting idle time and not keeping them longer than expected. It's really easy to just get caught up in work and not realize, hey, this patient's been here for a while. If you just recognize, okay, I checked this patient at 10 o'clock, I want to make sure I get them out by 10:30. Even if you do go overtime, which is fine, you just want to make sure you're making mental note of the time as you work. Because if you're not keeping a mental note of when the patient checked in, you can really get caught up in working and then look up and realize, hey, it's been over an hour or maybe 45 minutes, and I probably could have did things a little bit quicker to get the patient out of the chair. The very last thing I want to say is you want to make sure you prepare the room for the patient as well as the doctor. Before the patient comes in and before the doctor comes in, as a dental assistant, you want to make sure the room is set. You want to make sure you have all of the instruments that are needed. You want to make sure when the patient comes in, you have all of the patient's concerns addressed and know what questions they will have for the doctors, because that saves a lot of time. Because can you imagine if you just call your patient back? You call your patient back at that moment, the doctor comes in, the patient starts asking the doctor questions, the doctor has to think about the questions and then give the patient an answer, and then you have to then leave out, go get the instruments. You can save time if you get all of the instruments that are needed for the procedure in the room before you call the patient back. Following, you'll call the patient back, ask the patient if they have questions for the doctor, do they have any concerns for the day, and then you will step out and let the doctor know the questions and the concerns the patient has. So next, when the doctor comes into the room, he's already addressing the concerns and getting right into the procedure right away, instead of wasting time. Doing that, you find that you'll have a lot of time to work on your procedure, and you'll just become more efficient and faster as a dental assistant. So those are all my tips on how to become a faster dental assistant. If you like this video, go ahead and give it a thumbs up, comment any questions you may have, subscribe, and I'll see you in the next video. Bye.